All right, so now we're going to do the neuro exam reflexes section. There is 3 superficial reflexes as well as 5 deep tendon reflexes, also known as DTRs, and clonus, which we will discuss as a complete neuro exam. The 3 superficial reflexes are plantar, abdominal, and cremaster. So the plantar is the one we'll start off with first, and you essentially come here, you have the patient relax, and you stroke the bottom of their foot. We'll do it on this other one. You saw those toes begin to curl. It would be abnormal if the toes were to fan, which is also known as a Babinski sign. The abdominal reflex, I'm going to go ahead and have you lay down, head here. We'll use proper draping. I'm going to go ahead and roll your shirt up to expose your abdomen here. You use this part of the reflex hammer and you go away from the umbilicus. And you look for that umbilicus to kind of move towards the area that is being used here against the fork. And whether that umbilicus moves or not during this reflex is not of a lot of clinical significance, but if there's an absence of the umbilicus moving during that reflex, that could mean that there's a potential abnormality. I'm going to go ahead and have you sit up now. Do you need help? Okay. We'll go ahead and just keep this over your lap as well. The other reflex is the cremaster reflex, which you would do on a male patient, where you stroke the inside of their thigh, and the male genitalia has a specific reflex. So now we'll move on to the deep tendon reflexes. We'll start with the upper extremity and then go to the lower extremity. So the upper extremity, I'll go ahead on this side first. Starts with the tricep. I'm just going to get her to relax and be nice and floppy. I'm going to feel for the tendon here. Okay, make sure she has plenty of dead weight. I'm going to flick there, and you see that hand go out just a little bit. I'm going to go in here and keep my hand on the inside of her arm. I'm going to grab for her tendon in here. I'm going to give a flick here and wait for that bicep to relax for me. Okay. The last one is the brachioradialis, so over the meaty part of her tissue here. You saw that finger move up there. We'll go to this side. We'll do this side as well. So relax for me, nice and floppy. Feel that tendon. Okay, you saw that hand move there. You saw the thumb move there just a little bit. Relax. And you saw the hand jerk out there. Now we're going to do the patellar, the lower extremity. And for this, I'm going to go ahead and use a couple tricks. So I'm going to have her grab her hands and pull them apart to keep the muscles tense up here and these muscles relaxed, and have her look away by looking up at the ceiling. And then I'm going to bring my hammer down over her patella, find that nice little soft spot. And she does not have that great of a reflex. There it is. It was kind of late if you saw it there. So I'm going to come down into that groove. So it's just a small reflex that you see there. Okay, so now I'm going to kind of shake her foot a little bit to relax. I'm going to hold the foot in a slight bit of dorsiflexion, and then I'm going to get a nice swing into the back of her Achilles here. You saw that foot jerk down there. Just as a technique thing, I like to hold the reflex hammer between these 2 fingers, and then as I swing, I kind of pull the reflex hammer with these other fingers into my hand, and then I get a nice good sticking motion. I'm going to go ahead and come over here for this foot. So just relax for me. Okay, I'm going to hold that foot in slight dorsiflexion, and then we need to come over to the other side. Let's do the raw, unedited version here. Okay, so just relax for me. Hold that foot up, and you'll see, you saw that foot just kind of go down there before. So let's talk about the last test you would do as part of a complete neuro exam. This is testing for clonus. You would hold the foot like this, make sure that their leg is relaxed, and then you would dorsiflect the foot like this. And you would see if there was any beats of clonus. So you just kind of jam that foot up, and she doesn't have any hyperexcitability in her spinal cord tract. That would indicate positive clonus. So that is reflexes.